So looking at some conditions that we have with the respiratory system. So we look at resistance. There is kind of resistance based on breathing that can change the energy component of breathing. So resistance is how much force does it take to inhale or inflate, fill the lungs with air, or deflate the lungs. So how much force does it take to breathe in or breathe out? And there's normal lung resistance, the muscular activity of pulmonary ventilation, so diaphragm. And this is just talking about normal kind of resting breathing, and the external intercostals. It's actually a high energy demand because you're breathing in and out 12 to 18 times per minute, and the diaphragm's a very large muscle, and there's a lot of intercostals all through, kind of in between all 12 ribs. So 3 to 5% of your resting energy demand is actually going towards these muscles and breathing. And this is just breathing in, because remember, that's what happening contraction of these diaphragm external intercostals is during inhalation. If you increase the resistance, meaning you cause issues of some sort of breathing, then you're going to have an increased force, more kind of force behind these muscles to breathe in, or adding muscles to breathe out. So if you're adding muscles, that's going to increase the energy demand. If you are making it harder for the inspiratory muscles to contract and they're having to change, then you're going to increase the energy demand. So if you're looking at it, a lot of times when we talk about resistance, in this instant, we're talking about breathing in. So this is resistance and taking air into the body, but we also have it in taking air out, where you have to add muscles. So if you have higher resistance, the higher and more challenging it is to get air to go from your the outside of your body into your lungs. And this can occur naturally because of bronchoconstriction. So for whatever reason, your bronchioles have constricted in small diameter, that there's less air that can go through it. That increases resistance. But if we have excessive mucus or inflammation, so again, on a normal kind of airway, if all of a sudden you have a bunch of mucus, well, that's narrowing the airway. If you have a bunch of white blood cells and inflammation and swelling and all of that, that's going to decrease the diameter of your bronchioles or your conducting zone. Then you also have sympathetic, actually causes bronchodilation. So this is going to be where you are trying to dilate your bronchioles. And think about it, when you're fight or flight, you want more air to go to your lungs because you want more oxygen, and your tissues are getting ready to be more active because you're in a run and fight. So you're going to have less resistance with sympathetic. The lower resistance, then air's flowing through the pathways a lot faster and easier and getting down to the alveoli. So we're looking at chronic obstructive pulmonary disease, and these are different various kind of, this is a general term. So we're going to look at asthma, chronic bronchitis, and emphysema, which is going to be chronic obstructive pulmonary disease. So you hear COPD, and it's not necessarily one disease. It's kind of the general term that's causing restriction of airflow. And if you restrict airflow, then you get less airflow to the alveoli. So you reduce alveolar ventilation, meaning air getting to the alveoli. So we have asthma, chronic bronchitis, and emphysema are the ones we're going to talk about. Asthma, So most of the symptoms when you have it, you have an asthma attack, it's going to be acute and it doesn't happen all the time. So it's not like asthmatics are dealing with it all the time. They have kind of waxing and waning, so it comes and goes. With asthma, the conducting passageways, so this is going to be bronchioles mainly, are very sensitive to any type of irritation. So anything that comes in that can kind of cause them to be irritated, then it's going to cause constriction of their smooth muscle. So the irritation comes in, the airways are going to constrict, so bronchioles are going to constrict. Well, what's going to happen with constriction of smooth muscle? You're going to bronchoconstrict. So you're actually going to make your diameter smaller. It's harder for air to get down into the alveoli, so you're increasing your resistance this way. You also have irritation can lead to inflammation. So things that are due to inflammation, edema and swelling. Inflammation. Remember, swelling is part of inflammation. Increased mucus because of the irritation. You're trying to protect the walls of the bronchiole. So then you increase mucus, which is causing more issue with breathing, but it's because of the inflammation and the irritation. So breathing is difficult, you increase your resistance. For treatment of this, take a bronchodilator. So medication that's going to dilate your bronchioles, and that will decrease the resistance again and increase airflow to the alveoli and increase alveolar ventilation, and then kind of go back to normal. With emphysema, this is a permanent condition, and it's a permanent condition of enlargement or increase in size of the alveoli and destroying the alveolar walls. So normally, remember we have kind of the grape-like structures of the alveoli. They're all in clusters, and they're all kind of associated with it in little kind of grape clusters. Well, with emphysema, you're kind of making one large alveoli. So you're breaking down these walls and making a large alveoli. Now you would think, okay, well, what's the issue? Well, all of this area where you could have gas exchange occurring has been destroyed. So you have lost all this area, that gas exchange. So you significantly decreased where you can have gas exchange occur because you've destroyed the walls. It also decreases your elasticity of your lungs. So when that recoil of the alveoli, where it kind of snaps back and then is ready to expand again, you've decreased with destruction of the alveolar walls as well. So you need accessory muscles to help with breathing. And remember, we just talked about the more muscles being used to breathe means more energy demand. And we already have 3 to 5% of your resting. So now you're even increasing that higher. So you need more energy to breathe. Sometimes we can cause trapped air where it just kind of can stay in this really massive alveoli and it can't get out. It just stays in the alveoli and causes what we say hyperinflation, where it's just staying and it's sitting and it's not necessarily helpful because it's not moving. We want to exchange, we want to get rid of carbon dioxide and get oxygen. But if it's just sitting in the alveoli, filling it, then we can cause even more damage and issues and hyperinflation. And that's what we can see in the lungs. This is an x-ray. So looking at it, this is kind of more normal lung tissue that you should see some gray available to it. So you can see more gray in this. And then you can see all this area of black. On x-rays, if it's black, it's going to be air. So this is showing you a lot of trapped air in the lungs. That's not normal looking. So you should see more kind of this gray part. So continuously damaging the alveoli, the trapping of air, all of this is going to be chronic inflammation. Remember, when we have inflammation, it can be damaging. We can have swelling, pain, you can have leaky capillaries, all of those things. And it is damaging eventually to normal tissue. And you can cause lung fibrosis, which is scar. And wherever you have a scar, it's not functional. So just think of scars on your skin. They're weird feeling, they're different. They're not normal. They may not kind of tan as normal. They feel different because scar tissue isn't functional. It's just to kind of plug the hole, plug the damage, but it's not making it functional tissue again. So this is damaging in the fact that then we don't have um, proper lung tissue anymore. And eventually can lead to airways collapsing. And oftentimes we call people that have emphysema pink puffers. They're thin because of the increased muscle use and the increased energy that you take. But they're pink in color because there's not necessarily all of this is damaging to the lung tissue and you're using more muscles and energy, but you're still getting enough oxygen. So pink is going to be, you still get sufficient oxygen. It's just harder to breathe, but you can still get enough. So this is just looking, again, alveoli with emphysema is going to be, look at all the broken down alveolar walls. This is normal. So you have all the grape clusters. And here you have a lot of breaking down of and damage to the alveoli. So a lot of times emphysema is caused by smoking. So just showing you a healthy human lungs, kind of spongy, has all the different lobules, everything is kind of healthy looking. And then you have all this black and all this damage of the alveoli in the emphysetic lung, which is a smoker's lung. Lastly is chronic bronchitis. So whenever you have itis term, that's inflammation. And chronic means long term. So long term inflammation. And so you have swelling. Again, when you have irritation and chronic swelling and inflammation of airways, you're going to try to protect the lining by making mucus. So chronic bronchitis, oftentimes coughing, trying to get rid of the mucus. A lot of mucus and things can clog the airways. So if you have a normal bronchial diameter, but you're clogging it with mucus because of the inflammation, well, then that's going to reduce airflow, increase resistance. This is also often caused by cigarettes or anything that's irritating because you have irritation leads to the inflammation, which leads to the mucus. So smoking's constantly causing irritation. So anything that's causing a lot of irritation, which will lead to inflammation. Oftentimes with the inflammation and kind of long-term inflammation and damage to the tissues, you can have bacterial infections, and that can lead to more inflammation, which can damage lungs further. So we have increased resistance but this is different in the fact that you're plugging the airway. So there's going to be less airflow going through. So less air can get through the plugged airway. So less air, less oxygen. So you're still using a lot of energy, but not maybe not as much as emphysemic. So we call them blue bloaters people. So they're cyanotic, meaning that they have the blue tinge or purpley, not getting enough oxygen because of this disorder. So not enough O2 because we're plugging it.